Hey guys, Dr. Kosciuszko. So I wanted to address something because yesterday I was listening to the state update for Rhode Island, and there was a couple questions that were addressed that I felt like were poorly answered. And by poorly, I mean semi-misdirected as well as not enough information for viewers. So I kind of want to address this a little bit, and I feel like there's a lot of this out there right now. Okay. And just to start with, so the question that the physician was asked, and this is not to discredit the physician, but I just want to I want to point out something quickly. So a viewer had asked something on the lines of, does zinc help with immunity or boosting the immune system? And the response was, I don't know of any double-blinded studies that suggest that zinc helps boost immunity to fight the coronavirus. Okay? Now, this I did look into a little bit. There are some studies specifically on zinc. There's definitely studies on zinc in the immune system. Right now, because of how new the coronavirus is, there's not going to be a lot of those studies, okay? What's important is to understand that that's a very, the conclusion that was drawn from that, although that may have been true, it's important to understand that our body, and I think the person was trying to get to, hey, like some valid information. Hey, if I take zinc, do I have a better chance at fighting coronavirus? Okay. So here's what I'm going to give you as far as information, because to me, doctor means teacher. And that's really what doctor does mean, is teacher. So, here's what I do know. I do know that most, again, not to discredit, but most medical schools do not offer nutrition in their curriculum, okay? And so when you are asking a medical physician nutrition questions, it is in your best interest to know that that is not in necessarily their realm of expertise, okay? Just as in my realm of expertise is certainly not pharmaceuticals. If you were to ask me more questions, I would absolutely say, you know what, I don't know, I'm going to research that for you. Because I was given a limited course. I was given one course on pharmaceuticals. I was given all the background as a chiropractic physician of microbiology, physiology, lab diagnosis, all sorts of anatomy, x-ray. I mean, we have all the medical background. But having my master's in clinical nutrition and being functional medicine certified, I feel that it is a duty to answer this question with more thoroughness than what was given to the general public. I want you guys to understand that your body has 13 essential vitamins and even more so essential minerals, okay? And what this means is that essential vitamins, essential minerals mean that your body needs those to function, to operate, okay? So they are essential to our biochemistry. They are essential enzymes in specific processes for our body to function. So for instance, zinc is actually very involved in the immune system. It's involved in the fighting reactive oxygen species, which is actually a big part of the problem with coronavirus, and having patients who are having cytokine storms are having a lot of reactive oxygen species and inflammation. So whether or not there's a, double-blinded study on whether or not there's zinc can help fight coronavirus, I can absolutely tell you that zinc has an essential role in your immune system. And if you are deficient in this vitamin, you will have symptoms such as, surprisingly, lack of taste and smell. Okay. Decreased immunity, depression, things like that. So logically, I don't care if there's not a double-blinded study that says zinc can help fight coronavirus. I'm telling you that zinc is an essential trace mineral to our health. And so if you are not eating a healthy diet and you are not having things, especially if you have an altered diet, or if you have malabsorption, or you're not doing any sort of if you're on more of like a standard American diet, which is essentially called the SAD diet, if you're not getting a lot of good quality food with good quality vitamins and minerals, or your body is poor at breaking them down, or you have poor absorption and you have lack of zinc, then yes, you could be zinc deficient. So is zinc deficiency going to go against you when you have coronavirus? Yes. So this is a different approach to looking at this. I think it's a shame that there are so many physicians not talking about, and things are getting censored right now. Things are getting taken down because physicians are trying to teach patients how to quote unquote boost their immunity. And that's another thing I want to address really quickly. I kind of disagree with the boosting immunity part. I think supporting the immune system is much more accurate, okay? Because our immune systems, once we support them, our immune systems are very powerful. Our bodies are innately very powerful beings. We are meant to fight viruses. We are meant to fight bacteria. Now, we might not all have, and this is not a vaccine or anti-vaccination argument in that aspect. I'm just saying that our bodies are more powerful than we give them credit for, and there's a lot more that we can do to support health, which is not just the absence of disease. Okay, health is like we need to be taking our nutrition into account, because our nutrition is basically the foundation of our health. There's the whole topic of epigenetics right now is essentially everything, the way that I was taught and that I do stand by, is biochemical individuality and epigenetics, which is basically the expression of our specific genes through lifestyle, environment, and nutrition. Now, interestingly enough, if you go onto the CDC website, in America at least, you will find that the CDC actually says most of which are chronic diseases are the number one and number two and number three and number four reason for top reasons of death, right? Cardiovascular, smoking, lung disease, accidental overdose, prescription and recreational drugs. They will actually state that most chronic disease is preventable through diet modification, exercise, and lifestyle changes. It is actually literally up on the CDC website. Okay? So what I'm saying is that this is not something that the medical profession typically totes, because they weren't necessarily taught it. They weren't taught medicine to look from this frame. They weren't taught medicine. They were taught medicine as a reactive model. And that's what we need to understand as a society together. Like, stop censoring the stuff that's teaching people how to be healthy during this. It's not necessarily like, and I apologize for my, emotion and anger behind this, but hey man, everybody needs to have the best chance that we can here. We're in the middle of a pandemic. And, if we're only going to be taught how to react one way to this, and there's not going to be information out there to help people say, hey, this is how you can get healthy. Hey, this is how you can support your immune system. Hey, it's not saying that hey, this is an absolute guarantee you're not going to get this and get really, really sick. It's saying, hey, this is your opportunity to give yourself the best health that you can and the best chance, of fighting off infections, whether it be coronavirus or other types of infections. So I really strongly believe that, going back to the zinc aspect, zinc has, roles in the immune system of basic things like macrophages and neutrophils and parts of the immune system that deal with fighting viruses and bacteria. So to say that I don't know of any double-blinded studies that prove that taking more zinc is going to help fight coronavirus. I think I'm going to add to that and say, okay, that may be true. However, on the other hand, on the flip side, if you're deficient in zinc, you may be at more risk of having lower immune system. So if you feel like you might have an issue with zinc or a lowered immunity, I would just recommend that you take zinc. You know, like some of the logical explanations, like, hey, and by the way, most of these things, like if you take a multivitamin, it's not going to, like taking a multivitamin, unless you are on specific medications that are contraindicated, such as like a blood thinner or something like that, and you take vitamin E or vitamin K, that's going to cause pro-clotting, or that's an example. There are certain things, in general, patients who are not on medication, taking a multivitamin is excellent. Like, why would you not take something that is going to help you with all of your enzymes and biochemical processes that is needed for your body? That argument I've never understood that. So it's not going to hurt you, you know, and most doctors, all doctors, we take an oath, and the oath is first do no harm. Okay, and so I take that very seriously, and if there was a reason why I felt that, you know, a patient shouldn't take a vitamin or a medication or, you know, a vaccine, or should take a vaccine or anything like that, like, I'm going to tell the person that, because, again, first do no harm. Taking a multivitamin, unless in those specific cases, is not going to be harmful for you. You know, it's going to be supporting your body to help with your body's functionality and health. It's going to help with preventing your body from having improper, dysfunctions in your cells and in your, you know, your body needs those things. Your body, vitamin B, for example, your body needs vitamin B1 and B2 to synthesize energy in your mitochondria. Your body needs vitamin B12. Without B12, you develop severe neurological symptoms, and your spinal cord begins to break down. So that's how serious, you know, you can get major anemias and things like that from vitamin deficiencies, you know, and so this is something that's not as much addressed. So I just want to make sure that you guys, hopefully, that's kind of like an addition to what was said about the double-blinded studies. It's not to negate what another physician had recommended or stated. It's to add a different point of view, and it's to add information so that you can make the best choice for yourself. Okay? And if you feel that you might be deficient in zinc and you have some of those symptoms, there's specific zinc tests that you can do. There's ones that you can do like under the tongue and things like that, and you'll get a funny taste if you're deficient. You know, it's easy. But you're not going to, like most vitamins and minerals, most vitamins, especially the amount that's in a multivitamin, everything is mostly water soluble. So either you're going to excrete it out or you're going to use it. And half the time, depending on the one you take, you're not absorbing it very well. So you want to make sure you're getting one that you're able to break down well. Some of the heat compressed vitamins can be really difficult for our bodies to break down. But really, like, the multivitamin is based off of what's called a recommended dietary intake. It's like an RDA. Okay, so this is basically, here's the minimal amount of this vitamin you need to take to be not deficient. You know, most of these vitamins are not toxic. The only vitamins that you can get that are toxic are the 4 fat-soluble vitamins. So vitamin A, D, E, and K. Okay? E and K is very, very, very difficult to be toxic in unless you're taking an extreme amount of supplementation. Vitamin A and D can be a little bit more tricky with toxicity, but really we're talking about extreme amounts of multivitamins. We're not talking about a multivitamin every single day. We're talking about people who are getting, you know, on specific types of medication with high amounts of vitamin D. We're talking about people who are getting multitudes of injections of vitamin D or taking too high a supplemental level every single day, you know, because those get stored, you know. So if you're worried about taking natural things such as that to help with your immune system, I would always say, first, do no harm. but also think of the risk to benefit ratio. Okay, the risk to benefit ratio is, the risk is, hey, if I'm deficient in a lot of these things and I'm not taking care of my health and I have a poor diet, I may not have as good of a chance at, having a good immune system and fighting coronavirus. Does it mean that actively taking zinc is going to go after and kill and crush coronavirus? That's not what I'm saying. I'm saying support your body. Support your body, because your body is the host of which the virus attaches to. So if the host has a poor, poor warriors, poor immune system, then you're going to have less chance of fighting the virus. It's not to say that those things, immune system support protocols, are going to prevent you from getting it. It's not to say that they are going to stop you from contracting it. It's the whole point is, what's the best options for you to support yourself, and what's the risk to benefit ratio? Those are questions that you want to ask yourself. So I hope you guys find this helpful. If you do, especially if you're in Rhode Island, please share with your friends. Again, I mean no disrespect to any medical professions out there. I know we all have our different expertise, and I completely respect that and different point of views of medicine. But I do want to get the extra education out there, and that I feel like this is a missing piece in our system right now. And so this is where my expertise shines, and I want to give that to you guys and help you make the best decisions that you can, okay, for yourself and for your family. So thanks so much for watching, guys. I appreciate it. And if you have any questions, please comment below. I'd be happy to answer them for you. All right, have a good weekend.